I'm Dr. Garima Goyal. I am a senior consultant in Obs and Gynecology. I have my experience of over 16 years in this branch. I have done my MBBS and MS from Surat, Gujarat, and I have done my senior residency from ESI Hospital, Vasai Darapur, New Delhi. I have done research officership in AIIMS, New Delhi. I have done my fellowship in minimally accessible laparoscopic surgery as well. We are going to discuss about uterine prolapse. When the uterus protrudes or sags into the vagina or out of the vagina, that is called as uterine prolapse. Uterine prolapse happens when the ligaments and the pelvic muscles, they are weakened so that they cannot hold the uterus in their place, and in turn the uterus sags. That is called as the uterine prolapse. So the causes of uterine prolapse are pregnancy, that means childbirth, trauma during childbirth, delivery of a very big baby, chronic cough, lifting heavy weights, obesity. These are the risk factors for uterine prolapse. So the signs and symptoms of uterine prolapse are mostly the patient present to us with the complaint of something dragging into their vagina or something coming out of the vagina. Then the patient can complain of chronic back pain. The patient can complain of urinary leakage or retention of urine, or patient may complain of bleeding PV or discharge PV. Risk factors are again, as I told you, is heavy weight lifting, chronic constipation, chronic cough. So if a uterine prolapse is left untreated, it can cause a constant dragging sensation or difficulty in walking, difficulty in having intercourse, which is a major problem faced by the patients of uterine prolapse. We can do Kegels exercise. Kegels exercise is a very easy exercise to do at home, which any women can do, and also we can avoid heavy weight lifting, and the patient has a chronic constipation, it should be treated. Diagnosis of uterine prolapse can be done by the patient herself can tell that there is something coming out of the vagina, or it can be done by a gynecologist by doing a pelvic examination. We ask the patient to lie down on a couch, and then we ask them to bear down to see if the uterus is coming out to the vagina or out of it, and how much is the degree of the uterine prolapse. Yes, to some extent, if it is an initial degree of uterine prolapse, we can do Kegels exercise, and over the period of a regular Kegels exercise for 2 to 3 months, some degree or initial degree of uterine prolapse could be treated. Uterine prolapse is a benign condition, so it is not a condition of life and death. So it is serious, it can hamper your daily routine and activities, but it will not cause a life-threatening situation. Treatment for uterine prolapse could be conservative management or surgical management. Conservative management could be pessaries, which can be inserted into the vagina. It could be taken out from time to time and cleaned, but that is not a permanent solution for the uterine prolapse. The permanent cure for the uterine prolapse is surgery only. Surgery could be of two types. One could be the conservative surgery, in which the uterus is not removed, it is hung into the abdomen by some slings, or the other method is we can treat by hysterectomy, that is the removal of the uterus, which could be done again by 3 routes. Either we could give an incision on the abdomen, which is called an abdominal hysterectomy. We can do it from the vagina itself, which is called as vaginal hysterectomy, or we can put a very small nick on the abdomen and do it laparoscopically. So this is how uterine prolapse could be treated. much.